Right, hello. I'm Hannah Hinojosa, and today I'm going to be speaking about an issue that touches thousands of families across the United States: the critical shortage of organ donors. Every single day, men, women, and children wait on transplant lists, hoping for a second chance at life. And tragically, every single day, lives are lost because the organ they need never arrives in time. This is not because Americans don't care. In fact, the majority of Americans support organ donation. The problem is our current opt-in system, which requires individuals to proactively register as donors, which is not working at the scale that we need it to. We must act with both courage and compassion. This is why I am here to make the case for transitioning from our current opt-in framework to an opt-out organ donor system. The system would save lives, respect individual autonomy, and bring the U.S. in line with other nations that have already seen great success. The shortage of organ donors is a national crisis. Right now, over 100,000 people in the U.S. are on a transplant waiting list. Thousands die every year waiting for a heart, liver, kidney, or lung. Most Americans support donation, but support doesn't automatically lead to action. Many people simply never get around to registering. Some don't think about it until it's too late. In many cases, family members are unsure of their loved one's wishes, and valuable opportunities are lost. This gap between support and action is not a moral failing of individuals. It is a failure of policy design, and policy design can always be changed. Let's look at some evidence. A landmark cross-country study by Alberto Abadi and Sebastian Gay compared opportunities with opt-in versus opt-out organ donation system. These findings were clear. Presumed consent systems are linked to a 25 to 30% increase in cadaveric organ donation rates, even after controlling for factors like health, spending, and cultural differences. Similarly, a systematic review by Anita Rathalia and her colleagues found that opportunities with opt-out laws consistently have higher donation rates, particularly when paired with strong public awareness campaigns and family engagement. Another meta-analysis by Ali Arshad confirmed there's a positive relationship that remains significant even after accounting for national wealth or system health capacity. This means a law itself, the default setting, plays a powerful role in increasing donations. Our default setting in the United States being the opt-in law. We also have practical examples. In Wales, which adopted a soft opt-out system in 2015, consent rates climbed after implementation, with a significant number of donations occurring through deemed consent. According to Susanna Madden, this was achieved through public education and family consultation, a model that is especially relevant in the United States. By contrast, the U.S. system relies on people to take initiative and sign up. Many do not. Not because they're opposed to donation, but because they just never get around to it or think about it. This leaves grieving families to make difficult decisions under tremendous emotional stress. As a result, many potential donations never happen. This is a system that depends on perfect human behavior during imperfect times, and that is unrealistic. An opt-out policy would align our laws with what most people already believe, that saving lives through organ donation is a good thing. So, what do? Under the opt-out system, every adult is a presumed donor, unless they have formally opted out. Importantly, there are different types of opt-out systems. A hard opt-out means that the default, cannot be overridden. A soft opt-out, which is what I'm advocating for, still includes family consultation and respects the final wishes of the individual or their loved ones. This approach maintains personal autonomy. Anyone who does not wish to donate can simply record their decision. But for the majority who support donation and haven't taken action, the default status would now reflect their values. This simple shift, changing the default, has a profound behavioral impact. According to research by Lee Shepard and colleagues, defaults and social norms reduce procrastination, help convert intention, and lead to action. Some may worry that an opt-out system infringes on personal freedom or undermines trust. The concern is understandable, and this is why the design of the system matters. The evidence shows that the opt-out system does not erode trust when they are transparent and well communicated. In fact, they can enhance trust by making the process clearer. Ali Arshad and colleagues highlight the ethical safeguards like family involvement, transparency, and oversight. This alleviates concern about coercion. People remain free to say no, which changes in that silence is no longer treated as a decision. It is treated as willingness to help others. So what's the strategy? What's the implementation strategy? To make this policy work in the United States, the legal change must be accompanied by a strong infrastructure in communication. First, public awareness campaigns must clearly explain the new system and the right to opt out. Second, investment in hospital infrastructure, particularly the ICU capacity, and organ procurement logistics is critical to make sure that when the organs become available, they can actually be used. Third, we should train specialists, nurses, and coordinators to work with families. Just like in the Welsh model, these trained professionals can ensure compassionate conversations and culturally sensitive approaches. Finally, ongoing data transparency and monitoring must be built into the system, ensuring accountability and public trust. If we make the change, the benefits are clear. Number one, organ donation could rise by 25 to 30%. Thousands of lives could be saved every year. The burdens of families would be reduced since the default would be clear. And importantly, the system would align public policy with public values. This is not just about numbers. It's about mothers, fathers, children, and friends who could get a second chance that they deserve. As previously stated, my system that I am for is soft as opposed to hard. So what are the differences? And how much role does the family play? And how strictly are the laws applied when someone hasn't explicitly made a decision about donation? Here's a breakdown. The soft opt-out system, presumed consent, but with family involvement. The default rule. Everyone is considered an organ donor unless they have formally opted out. What is the family rule? If the individual has not opted out, their family is still consulted at the time of death. Families can confirm the person's wishes or in some cases choose to override the donation. What is the ethical approach? This model respects autonomy by allowing individuals to opt out, and it respects families by giving them a voice in a final decision. Examples from my research were Wales and then also Spain and France. They implemented a soft opt-out. So why are these places doing it? Why is it so common? It balances increasing donation rates while maintaining public trust and cultural sensitivity. The state presumes consent, but families still have influence at the bedside. Next, so we know what the soft opt-out system is. What is the hard? And why is it not exactly what we're going for? So presumed consent, no family override. The default rule. Everyone is an organ donor unless they've opted out, which is similar to the soft opt-out. Family rule. families are not allowed to override the difficult decision, which is the default. If the deceased didn't opt out during their lifetime, the organs can be used for donation automatically. So what is the ethical implications and approach? This model places that individuals' non-objection as the final word. Family wishes do not override the law. Where some places this is common. Austria. And that's it. So is it common? No, it's not as common. So why is it less common? While effective at raising donation rates, it can raise concerns about autonomy, trust, and cultural sensitivity if not paired with strong communication. The state presumes consent, and the decision cannot be changed by anyone else after death. That's why I would like to go with soft opt-out, which again, the state presumes consent, but the families still have influence at the bedside. So this is why many health policy experts recommend a soft opt-out as a practical and ethical middle ground for countries like the US. It respects both the individual choice and family values while still addressing the donor shortage effectively. In closing, the current opt-in system has served its time, but it is not enough. We have the research, we have the international examples, and most importantly, we have more responsibility to act. A soft opt-out organ donation system supported by infrastructure, public education, and ethical safeguards offers a powerful, proven solution to the donor shortage crisis. Every day we delay, more lives are lost, but with this policy, we can turn good intentions into real life-saving outcomes. I urge you to transition to an opt-out organ donation system. Together, we can save more lives, honor personal choice, and strengthen our healthcare system for the future. Thank you.